Welcome to Health Live at Seniors Today. We are here on the eve of World International Health Day that is observed on April 7th. And today we have Dr. Jagdish Kothari, who is a senior gastrointestinal and hepatobiliary specialist. He is a senior consultant, GI and hepatobiliary services at the HCG Cancer Center in Ahmedabad and a founder member of the Astha Oncology Associates. Before I welcome him, I'm going to introduce him. Dr. Kothari is an MS, MCH in surgical oncology, as I mentioned, at the HCG's Cancer Center and the Astha Cancer Oncology Center. After completing his MBBS and MS General Surgery from the BJ Medical College in 1988, he further continued his training in the field of surgical oncology from the Gujarat Cancer and Research Institute, leading to an MCH. Thereafter, he went for advanced training in GI and hepatobiliary oncology at the Sloan Kettering Cancer Center in New York, and he's also a visiting fellow at the Johns Hopkins Institute at Baltimore and the MSKCC in New York in the US. He's been awarded the Internal Cancer Research Technology Transfer Fellowship by the International Union Against Cancer at Geneva. He specializes, as I mentioned, in GI and hepatobiliary surgeries, and he has won many best presentation and best paper awards at various national and international conferences. He's been invited as a faculty, speaker and panelist in national and international conferences. He's an active member of the Association of Fellows of the UICC Geneva, the Indian Society of Oncology, the Association of Colon and Rectal Surgeries of India, the Association of Surgeons of India, and the Indian Medical Council. We invited Dr. Jagdish Kothari to talk about colon and rectum ailments and cancers for senior citizens. Welcome to Health Live at Seniors Today, Dr. Kothari.
Thank you so much, Mr. Maheshwari, for this kind introduction. And
Same show.
Oh, right. So nice. શનિવારની સાંજે ખરેખર મજામાં છું અને સિનિયર્સ ટુડેના પ્લેટફોર્મ પર આજે જે મોકો મળ્યો છે, I am very glad that I'll try and share, whatever is possible in this given period of time in a simplified manner, and then I'll be very much open to have the questions from anybody. I'll be more than happy to answer that in best of my capabilities.
Right. Thank you. And before we invite Dr. Kothari to make a presentation, which he is going to be making to us, those of you who have questions, as always, please put them in the Q&A tab. Mention your age and your gender. Do remember that sessions like these are advisory in nature. So if you give your medicines, etc., it's fine, but we may not be able to answer a question in a very detailed manner. And it's always good to have a clinical examination by a medical practitioner. That is of primary importance. Of course, you can reach out to Dr. Jagdish Kothari and take a teleconsult with him. But the question is that it's always good to get a first-hand examination by a medical practitioner. So that's the advice that we give every week when we conduct this session. Over to you, Dr. Kothari.
It's really an honor and pleasure, Mr. Maheshwari, as you mentioned before that, you have conducted so many this kind of webinars and invited leaders in the field. And I would say this is one of the best activity that is being carried out on this platform. And I'll try and do the justice. Beyond just to start, I'm going to touch upon in the two parts. One is the general aspect of the colorectal cancer and the real change which has occurred over past, I would say, at least for 1 decade in our country and couple of decades in the world, the advancement in the surgical aspect. Just to give you a simple glimpse that, this is no more a Western cancer, and it has started becoming one of the most important cancer when we talk about ailments in the male and female, both genders. The third most common, and to say that, this cancer can be prevented, can be diagnosed early, and can be treated well in time, gives an excellent prognosis. So these are three very important aspects of this cancer. A simple anatomical fact is, what is colorectal cancer? The colon, which is a large intestine, and the rectum is the terminal part of the large intestine, and we always combine it as a colorectal cancer. And it starts as a small polyp in any part of this colon or rectum, and if diagnosed in the polyp stage, as I was trying to say before, polyp is not cancer, and if it is diagnosed and treated in a polypoidal stage, then we are able to prevent the cancer developing from this polyp. So this is very, very important aspect of the colorectal cancer. Just to give you a corollary, that breast cancer, you do a regular mammogram. Mammogram does not identify pre-cancerous condition. It identified the cancer condition in a female breast, while here the polyp, which is not still a cancer, can be identified and the cancer can be prevented. Just to enumerate the risk factor, this is more common after the age of 50. These days, on our various platforms, we have started discussing this early onset colorectal cancer, because this is also now happening across the world, that we see boys and girls in their 20s and 30s suffering from colorectal cancer. But just to say that the age, it is most common after the age of 50. Male are at more risk than the female counterpart. Family history, this is very, very important aspect. The advancement has occurred in diagnosis, the genetic history, and the risk related to the genes. And there are few cancers where the genetic risk has been identified. So colon is one of the most important cancer, where just to give a perspective, there is known as a Lynch syndrome family, where the chances of development of the colon cancer in this family is high. So family history is quite important, and nowadays all our patients are being counseled by the geneticist to identify the risk factor in a particular patient and the family, and then guide them, counsel them that what are the additional things to do for them to avoid the development of cancer in them. Then inflammatory bowel disease, as you would know, the Crohn's disease and ulcerative colitis, these are the precancerous or the high risk group. Then people who tend to have a low fiber diet and high fat diet are at a high risk. Same way, the processed meat and the red meat in higher consumption with low fiber has a little higher risk of development of this cancer. Same way, as you would know that in many cancers, obesity, physical activity, low physical activity, tobacco, alcohol, these are considered risk factor for these developments. The common sign and symptoms of these cancers: change in bowel habit. Somebody who is passing stool, say, just 1 or 2 a day, and if he starts having more than 2, 3, 4 frequencies, or less frequencies than what it used to happen. Some patients would develop diarrhea, and the other half would develop constipation. So, diarrhea also can one of the symptoms in some of our patients. There are, of course, reasons for that when the obstruction occurs, the patient is not able to completely evacuate himself or herself, and that's how there is a frequency which is known as diarrhea. Then bright red or dark stool is also one of the hallmarks. The narrower stream of the stool, discomfort in abdomen which is otherwise unexplained, weight loss unexplained, anemia of unexplained etiology. These are the signs and symptoms of the colorectal cancer. Once patient has this kind of symptoms, and when they come to us, there are various things which are done. for making a diagnosis in there for the rectal cancer, digital rectal examination, that is the examination by a specialist by a finger through the rectum, and we are able to see about 7 centimeters of the lower rectum. This is very important tool for this part of the examination. Then sigmoidoscopy or colonoscopy, by which we pass this endoscope through the anus and see for the entire colon and take a biopsy to establish a pathological diagnosis. Then once the diagnosis is made that particular patient has got a cancer, we need to stage that patient. So then we will do the CT scan or a PET scan, and this is how the pre-treatment diagnosis is made. As I mentioned here, it is mentioned in the last line, the genetic risk assessment is now integral part of our counseling with the patient and the family. Treatment options, to put it very simply, surgery is the only treatment of choice for permanent cure from this cancer. So this is extremely important. So surgery is the main treatment of choice for the cure of this cancer. I'll talk in detail about the recent advancement which has made a big difference in the management of colorectal cancer. And besides surgery, the chemotherapy, the radiotherapy, targeted therapy, and immunotherapies are various treatments which are utilized at various stages and under various sequences in the inpatient. Now, when we talk about this particular cancer, the surgery which I was trying to allude to, that robotic surgery has become very, very important part. And what does the robotic surgery means? The robotic surgery is comprising in which, as it is shown here, there are 3 parts of the robotic systems. One which is on the left known as patient cart, and there are 4 arms in this cart which are introduced through 5 to 7 millimeter holes, and the surgery is done utilizing them. The surgeon console is where the surgeon sits, and the vision cart is where the whole heart of the computerized system is there. So
whether you or someone you love is preparing for
small
robotic assisted
cartoon
surgery,
film.
it's helpful to know what to expect. Your surgeon and care team may have proposed different surgery options, like open, laparoscopic, or robotic assisted surgery. This video will give you an overview of a typical day with robotic assisted surgery. We'll also cover some background on what a robotic surgical system is and how it's used during surgery. First, let's focus on the pre-surgery process. Once you check in, your care team will begin to prepare you for surgery. Your surgeon and other members of your care team will review your procedure with you and answer any questions you might have. When it's time for surgery, you'll be brought into the operating room, joining your surgeon and members of your OR care team. The robotic surgical system will also be in the OR. Before your surgery begins, you may receive medicine to help ensure you don't feel any pain during the procedure. Your surgeon will stay with you in the room and control the robotic system to perform the entire robotic assisted procedure.
The robot itself doesn't do any surgery by itself. It is robotic assisted surgery.
Because the initial incisions range in size from only 5 to 13 millimeters, which is about the width of your fingertip. Through these openings, your surgeon will perform the surgery using a camera and other instruments. You could think of robotic surgical systems as technology tools that enhance your surgeon's capabilities. For example, the camera may allow the surgeons to see the surgery area in 3D and magnified up to 10 times its normal size, so they can see details larger than with the naked eye. It would be like looking at a coin the size of a plate. During the surgery, your surgeon will use instruments that move like a human hand, but with a greater range of motion. Some systems even have built-in
more power of
technology
motion than
helps your surgeon
actual
each instrument.
my hand can move.
When
So
surgery is complete, your
this is
surgeon will
real
close any
enabler.
incidents.
These are the
The
small
care team then
incisions
moves
which are
you
put.
from the operating room to a recovery room. You may stay in the recovery room until you wake up. Depending on the surgery, you may go home that day or stay in the hospital. Your care team will let you know before surgery how long they expect your stay in the hospital.
So nowadays, we generally discharge after colorectal surgery in 3 to 5 days. And honestly, some of the patients, they are able to resume their work, the active work within just a couple of weeks or sometime even less than that. One another aspect which, I would like to highlight here is the challenges in the elderly patients. When we have to do a surgery in the elderly patients, as now in the world, people have started surviving longer. And as I mentioned before, that the colorectal cancer is the cancer which occurs in a late age. So more and more patients suffering from this, elderly patients are coming to us. And as you would know, that, they can have a compromised heart, lung, liver functions. And if we do a classical open surgery, this would lead to a very large incision, and the recovery from the anesthesia and main challenges of the lung function returning has remained a challenge. And in past, we were really not able to do the surgeries on this kind of patients. Now with what is known as minimally invasive surgery, previously laparoscopy and now robotic surgeries, we are able to offer surgeries on this kind of patients because they would recover so fast. We start them feeding next day or the day after, as early as in 24 hours. And that's how the whole recovery process is fastened, and the hospitalization has been less trauma to the tissue, and has been really very, very useful. So these are the advantages which are enumerated: less blood loss, hospital stays short, faster bowel function, because I have not opened up the entire belly and exposed to the surrounding for 3-4 hours. So there are less inflammation, what we call it as sujan kam aati hai. So they recover really very fast. As there is a less pain, they breathe well, and that's how their lung functions and heart functions are also not affected. And better clinical outcome. Infection, chances of infection, one of the major complication of colorectal surgery is the wound infection. Here the chances of infections are also less because we have done it in a minimally invasive way. And after surgery, other problems are also less. So looking ahead, the future of robotic assisted surgery in colorectal cancer is becoming more and more common. And this is what this is one of the patient who had undergone a surgery. He is 84 today. He is just speaking in Gujarati. I'm just running for only few seconds.
સ્વાસ્થ્ય સારું નહીં રહેતું એટલે કોલોનોસ્કોપી કરાવી અને એનો રિપોર્ટ આવ્યો. એ રિપોર્ટ મેં મારા પરમ મિત્ર ડોક્ટર બંકિમભાઈને મોકલાવ્યો અને એમણે એચસીજી કેન્સર હોસ્પિટલના માનનીય ડોક્ટર જગદીશભાઈ કોઠારીને એ રિપોર્ટ બતાવ્યો. બીજે દિવસે મને મળવાની અપોઇન્ટમેન્ટ આપી અને હું કોઠારી સાહેબને એચસીજી કેન્સર.
Now just the closing remark, once again, I would say that it is very important to remember this symptoms, troubles, going to the bathroom or blood in the stool, abdominal pain or discomfort of unexplained in nature. Some discomfort for a couple of days after having parties or after traveling is fine, but if it is really bothering for more than, say for example, a week, then you need to be careful that you need to go to your doctor and have yourself examined. Same way, unexplained weight loss or anemia. The diagnosis is very simple, and there are, well-established pathways to make the diagnosis. As I mentioned, early detection and access to the advanced treatment is the key for the successful outcome. Successful outcome means permanent cure in this kind of cancer. This is really, really very much treatable. The simple question is this now, that can it be done in elderly? And my answer is, if not robotics, and then what? And last but not the least, I would say no age is standard to render promised and precise healing in today's era. I think that's what I wanted to say today, and I would be more than happy to take any question.
Thank you very much, Dr. Kothari, for an excellent and detailed presentation. Once again, I would request everyone here to put in your questions here. If you do not want to take your name over here, it's fine. We will not reveal your name, no problem. Doctor, can I take some questions that have come in?
I'm sure, yeah.
There's one from Mr. Prakash Jagdani, who's 63-year-old. His question is that he has constipation issues between hernia and one of prostate. He had a fissure 66 years back. Again, the pain related to fissure has started a couple of days back. Some small bubble type tissues have developed on external part of rectum and pains a lot. Please advise what he can do.
Yeah. So, Mr. Jagdani, as he has described his clinical symptoms, I don't really worry much about the major concern here. This is more related to constipation leading to the fissure, and what he's talking about, some bubbly things, or that is the external hemorrhoid, is what we say, external piles. So I think what he needs to do is take care of his constipation, because as the age advances, some of the patients, some of the males would develop constipation. So he might require some additional measures in day-to-day life to avoid constipation, and take opinion of any general surgeon. And I think he'll be able to fix this problem for sure. My good wishes to him.
Right. As it happens, Mr. Jagdani is based in Ahmedabad, so he's in your city, so he can always, of course, visit you. We have a question from Mr. Rajiv Kumar, and that's a question that has also been asked by somebody on the SMS to us. The question on the SMS is isabgol something that is good for the colon? And the other question that we have from Mr. Rajiv Kumar is, does lifelong daily use of isabgol help in preventing cancer?
So two parts of this question. Is isabgol good? Yes. The only thing is, you don't need any fancy isabgol. Simple isabgol is fine. In a required quantity, if you need it, if it is helping you with your constipation, that is fine. Not to prevent colorectal cancer. Have we found out anything that isabgol prevents colorectal cancer? There is no evidence. So not for that reason, but taking care of constipation for sure.
And so how would you recommend isabgol, the consumption of isabgol?
So,
with water?
Yeah. So warm water, maybe about, 1 to 2 teaspoon. We always say that, that you can moderate your dose of isabgol depending upon what kind of diet you had taken today or yesterday, and what kind of bowel position is yours. So I would always recommend that you should modify the dose of isabgol, and whatever suits you is absolutely fine. There is no typical recommendation like many of the other medications that how much you must take.
So with warm water before or after a meal? Doctor, would you recommend with warm water before or after a meal?
After meal with warm water.
After a meal with warm water and once a day. We have a question from Mr. Bert Reynolds. What would you recommend? What supplements would you recommend for a 66-year-old lady, I guess, to prevent from any problems on the colon and rectal front?
So, we would have advices like, as mentioned, high fiber, low fat diet. This is what is recommended. And second thing is, at the age of 66, she must undergo some kind of a screening examination, even though it is not standard recommendation in our country to undergo a colonoscopy. But to people who really want to be careful and want to take care of these colorectal problems, if there is any high risk factor, say for example, a family history or something like that, then they should undergo a colonoscopy. And this colonoscopy, if normal, completely normal, the next repetition of the colonoscopy is after 10 years. If polyp has been found, the doctor will send the polyp for the biopsy, and if there is dysplasia, any precancerous condition, the colonoscopy needs to be repeated after 1 year. Otherwise, after 10 years, that is fine, and one can easily stop after the age of 75 or 80. No further colonoscopies to be done.
Right. Thank you. We have a question from Shamla Ravi, who asks, how effective is FIT DNA test in diagnosing colon cancer?
Yeah. So, this is one evolving modern test, and this DNA test is still positivity has definite value, but negative DNA test will not always rule out. So it's a complementary test is what we would say, that one may carry out. Sometimes it is not possible to undergo this kind of procedure for various reasons. The patient is immobile or not ready, prepared for colonoscopy or things like that. Then this test can be done. Positive as a value, as I would repeat that. Otherwise, to be done in conjunction with the colonoscopy.
Right. Thank you. We have a question from Sharda ji. She says, I'm 65. I get diarrhea sometimes, but resolves by itself. Is this a problem?
Yeah. So see, the question is, I probably...
Sorry, doctor. Sorry, doctor. I have another question which has just come in. It is that I have frequent issues of diarrhea and constipation because of certain excesses that I may have in my diet. And it happens very frequently. I just take some medicine or I don't even take any medicine and it's solved. But is there a reason for worry?
Yeah. So, as I had put it in my presentation, diarrhea and constipation, alternate or sometime diarrhea and constipation. This is one of the symptoms that we must always be careful about. And you definitely need to see your doctor. And these are sometimes what we call it as inflammatory bowel disease like symptoms. Cancer is always a rare problem. There are so many non-cancerous problems which are giving rise to the same set of symptoms. But we want to really make sure that we have fixed those problems like inflammatory bowel disease or irritable bowel syndrome, things like that. And if it has not been fixed by the symptomatic treatment or some treatment, then one need to check for the scopy also if you are 50 years or more.
Doctor, there's one question that has come in and I think it is pertinent for this session is, doctor, is robotic surgery totally safe for senior citizens?
So, honestly speaking, at our institute, nowadays, if a person is more than 70 years of age, because of my past experience, the way my patients have started recovering, the benefit which I see, I very strongly recommend that they must undergo minimally invasive surgery. Robotic surgery is the best way. Another option is a laparoscopic surgery. Why I would say, I had enumerated the benefits that when you are not opening up the belly of the patient, the recovery after this kind of a minimally invasive surgery, the recovery of the lungs, the recovery of the heart, and the resumption of the normal movement, and you are able to drink and eat much faster, leads to a safe outcome from this kind of surgery. My oldest patient has been 94 years. The another patient has been 92 years. We strongly recommended surgery because if you don't do surgery in this kind of patient, they will develop an obstruction. We promise them that once we do surgery, we'll send you home, we'll take care of you at home. My team will visit. We never ask that person, that old lady, to visit our hospital, and we could fix her problem of the cancer. So these days, it has really matured over a period of time. This is no more a new tool. In our country also, at our institute, we are doing it for now 8 years, and in world it is being done for more than 20 years now for various ailments. So this is no more a new tool. The outcome has been really very good. And just to say in last word, why I continue to do robotic surgery, the only one reason is that I see my patients recovering very well.
You see your patients recovering very well. You said that, people above the age of 70, robotic surgery is perhaps the more advisable thing to do. And what you're also saying, we hear you saying, is the fact that robotic surgery and has matured in this country, and even in non-metros like Mumbai or Delhi, it has progressed a fair bit, and there is sufficient medical personnel available to handle situations if at all required. Thank you very much, Doctor, for this session on the colon and rectum and the ailments and the cancer associated with it. It is indeed an important part of the human physiology that we must pay attention to issues concerning the colon and the rectum, which is perhaps often dismissed and not taken very seriously by people. And for all of you over here, thank you very much to Dr. Jagdish Kothari from yourself, and to the people at your hospital who have facilitated this. Thank you very much, Dr. Kothari, and to all of you here. Well, thank you for being here. We will be back once again next Saturday at 5 p.m. for another session of Health Live at Seniors Today. As always, if you would like to pre-register for our sessions, you can do that. The link is there in the chat window, and you can use that to pre-register. You can, of course, also make use of our the opportunities that we offer through our Evergreen Club. The Evergreen Club exists, and we have sessions every day, morning, afternoon, and evening, which you can participate in. And of course, there's the Seniors Have Talent. The season 14 finale is scheduled to happen tomorrow. That is April 7th at 11 a.m. And remember, you have senior citizens who are all above the age of 60, Doctor. All above the age of 60, and people from across the country who are participating in it. And it is indeed very heartening to see that. We've been having this for the last 13 seasons. And the first activity of Seniors Today was, of course, the magazine and the website. After that, we started with the Health Live session that we have here. And then we started with the Seniors Have Talent in September 2020, and it has had 13 seasons. This is the 14th season, which is going to culminate with the finale tomorrow. So thank you very much again, Dr. Kothari, for being here. Dr. Jagdish Kothari was with us just now for the Health Live at Seniors Today session. The video, the edited video and the takeaways will be there on our website on Monday evening, and you can refer to it. You can refer to the video. Those of you who have missed the presentation can also have a look at the presentation. Next week is a big festive week. It is Gudi Padwa in Maharashtra. It is Ugadi in Karnataka and Andhra Pradesh, and various other festivals that happen in this period. It is also the festival of Eid, which is there on the 11th or the 10th, depending on the sighting of the moon. And have a great festive season. Enjoy responsibly. Eat responsibly, I would say. And of course, we really thank the doctors who are participating so actively and so openly. And you've seen the presentation that Dr. Kothari has had today, and the various doctors whom we've had in the past. Thank you very much, Doctor, and all the best. And Aujo.
Indeed, Mr. Maheshwari, it was really a pleasure. And when I was introduced to this by our colleagues, I was really intrigued, that this kind of platform and so much activity has already been done. It's incredible. Lot of compliments from me, sir, that and best wishes. And do let us know anytime in future if you need any help from my team. We would be more than happy to participate.
We will do a session in Gujarati, sir.
Okay.
Sometime we will do. We want to go to other languages, and we will have one in Gujarati very soon.
Choccas. Gamshe.
Saruche. Thank you very much.
Subscribe now and press the bell icon. Never miss an update.